President, the American people have spent the last several weeks hearing that the Senate will vote on its new version of Trump Care by the end of the month. It's now June 19th, and the American people are still in the dark about this bill. There is no text, there is no legislative analysis of this bill, no scoring of what the financial ramifications are. The American people and much of this Senate is in the dark. In the dark about how much costs are going to rise. In the dark about how many people are going to lose insurance. In the dark about whether a pre-existing condition will once again be used as a weapon against them by insurance companies. If the news reports are to be believed, and that's all you got right now, a vote on this massive proposal affecting the lives of virtually all our people is days away. No one outside of a group of 13 men, all Republicans, knows what is being considered. In my view, this is as stark an example of legislative malpractice as I can remember. It is time for Americans to get loud, do their part, and make sure their voices are heard on an issue that is so personal and so vital to our people and their families. If and when this bill hits the floor, the debate is going to go by very quickly. By the standards of the Senate, it'll be over in a flash. So this afternoon, I want to be direct with a few key points for those across this country to remember over the next 2 weeks. First, the Republican health care plan is going to raise costs for the typical American. If you're an older person nearing retirement, 55, 58, 61, you are going to get hammered with an age tax. You're going to be forced to pay several times as much as a younger person for health insurance. Under the House Trump Care bill, 64-year-old seniors of modest means are going to see their premiums shoot up by 800%. I'd like to hear somebody try to explain to a lifelong trucker or someone who spent decades cleaning offices to put food on their family's table why that is an improvement in American health care. These are older people who already struggle to make ends meet, and they've been told for the last 7 years that repealing and replacing the Affordable Care Act is going to lower their health care costs. Now they face the reality of Trump Care, which says that they'll somehow have to spend the bulk of their income on health insurance, and in some cases take up nearly all of it. And it's not just older people who face this age tax that will see their costs rise. Trump Care cuts middle-class tax benefits for health care that were put in place under the Affordable Care Act, particularly in rural areas. That means premiums are going to be a much bigger burden on typical middle-class families. The Republican health plan ends the airtight, loophole-free guarantee that protects Americans from being discriminated against for a pre-existing condition. Working adults, 30, 40, 50 years old, who thought they were home free with employer-sponsored insurance, under this bill, could once again face some of the worst insurance company abuses, annual and lifetime limits on benefits. One new report says that 27 million Americans could get hit by annual limits, and 20 million could face lifetime limits. Here's what this means, Madam President. If you're a 35-year-old, for example, who develops cancer, you could bust that cap in a hurry. If you have to go through expensive surgeries and chemotherapy, busting those caps could mean that you face decades decades digging out from medical debts. Second, Trump Care is built around an $800 billion attack on Medicaid. Today, Medicaid comes with a guarantee. If you walk an economic tightrope, you're sick or injured, you will get the care you need. You can't be denied benefits. But slashing the program by hundreds of billions of dollars ends that guarantee because states are going to have to cut benefits. The best way to understand the consequences of that plan is to look at seniors who need nursing home care. The Medicaid nursing home benefit helps pick up the tab for 2 out of 3 nursing home beds in America. Because the fact is, growing old in America gets expensive. You can do everything right through a lifetime of hard work, scrimping and saving, putting off vacations or big purchases to be financially prudent. But still, a lot of people go through their savings. That's when Medicaid steps in for seniors to help cover the cost of nursing homes and other long-term care. 1 year in a nursing home now costs more than $90,000 on average. That's 2 or 3 times as much as a year of college education. So if Trump Care slashes Medicaid so deeply that seniors are in danger of losing the nursing home benefit, how are families fighting hard to pay their own bills going to be in a position to take care of older loved ones? Of course, Medicaid does a lot more than cover nursing home care. 37 million kids are enrolled in Medicaid, a vital source of support for kids and adults with disabilities. Medicaid is the only lifeline that thousands and thousands of Americans fighting opioid addiction have to be able to put their lives back together. No community anywhere in this country has escaped the opioid epidemic. Since Medicaid was expanded under the Affordable Care Act, it's been leading the fight against the opioid epidemic by improving access for millions of people to treatment for mental health and substance abuse disorders. But with the Republican plan's enormous cuts, thousands of people could lose their best shot to recover from addiction and lead healthy lives. Finally, what is especially unfortunate about this legislation is the process for writing this bill. It's being written behind closed doors. No input from across the aisle, and particularly from the American people. Madam President, I serve as the ranking member on the Senate Finance Committee, and I can tell you our committee has authority over hundreds of billions of dollars in payments for Medicare and Medicaid and tax credits. We haven't had any hearings. We haven't seen a bill. There's not the traditional process of a committee markup where you consider legislation. We're also the committee that on a staff level always has tried to work back and forth between Democrats and Republicans to try to find common ground. But with the majority leader keeping the process locked behind closed doors, Chairman Hatch and I, along with all of the Democrats and most of the Republicans on our committee, have simply been cut out. Back in the run-up to the Affordable Care Act, the one that President Obama was involved in 2009, the Finance Committee held more than 50 hearings, roundtables, and we walked through carefully the health reform bill. When the legislation was introduced, it sat online for 6 days before it was voted on in the committee. 564 amendments were posted online. More than 130 amendments were considered during the markup, and more than 24 Republican amendments were adopted, and the bill passed on a bipartisan basis. Again, Madam President, let me highlight it. More than 24 Republican amendments were adopted in the Finance Committee. As of now, there won't be a single Democratic amendment adopted in the Finance Committee. When the legislation went to the floor, the Senate spent 25 consecutive legislative days on health reform, the second longest consecutive session in history. That's how the legislative process ought to look. The committees do the hard work in the open, gather input from the American people, have a chance, Democrats and Republicans, to work together. That's not what's happening on Trump Care. This is a bill that is shrouded in secrecy, and the public is kept in the dark. There aren't going to be any hearings on the impact it's going to have on the millions of people who rely on Medicaid for health insurance. No hearings on what it means if you have all these loopholes in the guarantee of protection now Americans have against discrimination for a pre-existing condition. No hearings asking how a 64-year-old of limited means is supposed to deal with an age tax that swallows up most of their income. When the Senate Republican health bill hits the floor, there will be a very short debate before time expires and the final votes are cast. So I'm going to close, Madam President, by saying now is the time for Americans to be heard on health care. It is the time for Americans to speak out. For those who have a story about how Trump Care will affect their family, you can share it on my website at wyden.senate.gov, or you can use the hashtag #AmericaSpeaksOut. I intend to be back here on the floor with my colleagues, and many of us will be here often in the hours and days ahead. But I want to close by way of saying political change doesn't start at the top and then trickle down. Political change is bottoms up as Americans across the country speak out and speak loudly. Now is the time to do that because this debate is coming fast. Madam President, with that, I yield the floor.